Hello everyone, my name is Hamidah Indrihapsari from Universitas Indonesia. Here I want to present my latest research about the design of occupational health service information system in supporting COVID-19 surveillance for healthcare workers in public hospital in Indonesia. So here are the contents of my presentations. I want to present about the background, literature review, methodology, result, and discussions, also the conclusions of my research. So we have been known that COVID-19 is increasing highly in every part in the world, and government of Indonesia is fighting with the COVID-19, but despite all efforts, Indonesia has still become one of countries with worst hit by COVID-19 by having the highest number of cases in the Southeast Asia region, in addition to being the highest mortality rates in the world. As the data from the government of Indonesia in April 22nd, 2021 show the number of daily cases has increased to 6,243 people. Cumulatively, the number of positive cases has reached more than 1.6 million people and more than 44,000 of them died. But currently available medical staff in Indonesia are insufficient to deal with potentially increasing demands for managing this increasing number of COVID-19 cases in Indonesia. With all shortage in number of medical staffs, the escalating number of confirmed and suspected cases of COVID-19, the workload of healthcare workers in Indonesia has also been overwhelming, leading to long and irregular hours of continuous work, consequently triggering the psychological distress, increasing the risk of healthcare workers infected by COVID-19. And until 28 July in 2021, it was reported that 1,631 healthcare workers died because of COVID-19, and the highest number was from East Java and accounted for 506 healthcare workers' deaths. And Public Hospital of Nganjuk is one of COVID-19 referral hospital in Indonesia in East Java with the positivity rate among the staff in July 2021 is 80%. This number is almost 5 times higher than in 2020, which is 4% cases. As advised by WHO, every healthcare facility should have an occupational health program, and recording, reporting, and all activities related to occupational health service need to be carried out regularly. But the data documentation were very weak in Public Hospital of Nganjuk. Recording and reporting systems that are still manual will complicate and slow down the process, search and storage, making the monitoring process obstructed and affect the review processes. This pandemic highlighted the urgent need to improve the data documentation, recording, and reporting system of occupational health service in hospital. So this research developed occupational health service information system to handle these problems using prototyping method in public hospital of Nganjuk. And the literature review about this, I want to explain about the occupational health safety, which is has aimed to promote workers' health in every aspect of physical, mental, and social, also productivity in the workplace, prevent and protect workers from any occupational risk from things that cause illness or injury related to their work placement in accordance with the physical and psychological abilities of workers, which in short means the suitability of work for workers and everyone with their works. Method for identifying occupational hazards and related health problems can be referred to as work environment assessment, biological monitoring, medical surveillance, and epidemiological approach. And in this research, I will explain about the hazard surveillance, which is defined as the process of measuring the distribution, trend, use, and the level of exposure of the hazards responsible for the occurrence of disease and injuries. With the workers' health surveillance entails procedures for assessments of workers' health by means of detection and identification of any abnormalities or disease. And the working environment surveillance involves the identification and assessment of environmental factors that may affect workers' health, such as the state of occupational hygiene and sanitation, organization of work, personal protective equipment or PPE, and control system, and workers' exposure to hazardous substances. Occupational health service aims to improve and maintain the highest degree of physical, mental, and social health for hospital employees in all types of work, prevention of health problems for workers caused by working conditions, protections of workers in their work from risk due to adverse factors, health and placement and maintenance of workers. The methodology I used in this research is using prototyping methods, which has several stages to be a complete systems. But in this research, the development stage were only until the logic designs. So the step is user requirement analysis and then system designs. The research was done in June until July 2021 with 12 staffs from Nganjuk Public Hospital, East Java, Indonesia, as the informants for the requirement analysis. The result and discussions. So for the user requirement analysis, results, the management and structural department of Nganjuk Public Hospital has the strongest power among other entities to support the proper functioning of occupational health service information system development. But in regard to support the development of the system, their position itself are mostly natural. As for the Occupational Health and Safety Committee, the Medical Check-up Team, and the Infection Prevention and Control Committee, they have moderate power in supporting the system design and are in a position to support its implementations. As for the support, they have big power to support the implementation of system design, but are sufficient to support its implementations. This result constitutes a good start since the management department has the power to recruit staff, but for the development of the system in the next stage, there still need for the management department to be fully supported its development. In Nganjuk Public Hospital, there is still no fixed standard for operational procedure specifically for occupational health service. So far, the program is implemented by the outpatient installations and medical checkup team. The data from the medical surveillance was by far collected by the medical record department with manual papers record and not differentiate between staffs and patients. Also, there was no follow-up from the medical surveillance results as the data documentation was missing. These conditions aggravate during this pandemic as the hospital is much overwhelming with the high number of staffs who are infected with COVID-19. There is an urgent need for hospital to do the medical surveillance for staff during the pandemic, but there is still no database about this. So surveillance can directly measure what is going on in the population. And this system itself is very much needed in this hospital. In relation to the COVID-19 pandemic, real data collections on confirmed COVID-19 employee is required, and also data regarding the COVID-19 risk assessment for employee for the Nganjuk Hospital to the large number of employees who have confirmed COVID-19. To get the data, an assessment is done through the Google Form link that has been distributed by the Infection Prevention and Control Committee to confirmed employee. But the data is only owned by the Infection Prevention and Control Committee, IPC committee, and analysis of the results of the assessment takes time to reach the decision makers, which is the management and structural department. In this case, the structure of the in the case of structure of the Ganjuk Hospital, making this surveillance and risk assessments is less efficient and effective because there is still no integrate integrations among the units in the hospital itself about this surveillance data. This result system design for logic design in flowcharts, which is when a staff there is a confirmed case from staff, then the IPC committee has the notification to do contact tracings. And then based on this contact tracing result, the OHS committee or Occupational Health and Safety Committee in hospital do the risk assessment based on contact tracing result and input the data in the database system. And in this, actually, this data is then has the hospital staff, which has the confirmed case, do daily self-monitoring for symptoms and any medical or needs in the database system. And this is the entity relational diagram, which confirmed hospital staff and APC committee has the relations in contact tracings, and then IPC has an OHS committee has relation to the follow-up in confirmed case, and the OHS committee do the risk assessment about COVID-19 for confirmed hospital staff. This is the context diagrams, which is the confirmed hospital staff need to input the daily assessment of symptoms, and then the management can from the system can know and monitoring and evaluates the data from contact tracing, this assessment data from staff and IPC committee contact tracing data, and OHS committee input the risk assessment of COVID-19 and can get the confirmed case data from the systems. So the management department can do very much more effective and efficient to do the decision make regarding to the result from the this data, which is inputted from the confirmed hospital staff, OHS committee, and IPC committee. For the conclusion of this research, there is an urgent need to do the surveillance in every healthcare facility for occupational health service program during this pandemic, especially for any COVID-19 referral hospital. The COVID-19 surveillance system for healthcare workers should be done regularly, real-time, effective, and efficient. The surveillance also should be consistent and monitorable by the management department or the decision makers in the health facility to take the follow-up and evaluations about the recent conditions. It is also suggested that for the next development stage of the information systems, coordination with the programmer and ST staff is need to be well developed. And so this is the reference. And thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.